We have the founder and CEO of MediBookr, Sunny Nadolsky.
Well, good evening. Thank you so much for making it to here. And so as you mentioned, so my name is Sunny Nadolsky. I'm founder and CEO of MediBookr. MediBookr is an online marketplace for medical imaging, like MRI, CT scans. So the problem we're trying to solve for the patient side, think this way: if you or someone you know trying to do an MRI, you might have noticed there's a big price variance from a few $100s on one side of the street to several $1,000s. What's more, there's really no easy way to capture the availability, quality, location, other than calling them one-on-one, kind of like the hotel industry 15 years ago, which wastes a lot of time on the patient side. As our health insurance moved toward high deductible, high copay, patients have to price shop around to find what's available, what's affordable to them. For the imaging centers, they also struggle with rising cost due to the value-based pay, bundled payment, which is going on in the healthcare industry, and also facing savvy shoppers. And you wonder how big the problem is. Last year, Americans spent $100 billion on medical imaging alone. So we focus on the most painful area, which is the outpatient imaging center, 19%, which is about $19 billion. And of course, the patients, as I mentioned earlier, those are high deductible, high copay healthcare insurance plans and the uninsured. So to solve this problem, we build MediBookr, where patients can quickly find the transparent information and compare quotes on availability, location, rating, and price, of course. That's the most important one. And then quickly book the appointment with the desired one. Imaging centers can quickly list their profiles, price for the services, offer quotes, book with qualified patients, and also improve their operations with analytics we provide to them. And so as a result, they are able to reduce cost, improve their operation on MediBookr. So our business model, we are free for patients. We charge the imaging centers a lead fee of 10%, about $42, because the average procedure is about $420. We also charge them a monthly fee if they wish to receive data analytics to shed light on their operations. In due time, we can also generate revenue from advertising. We are currently launching in DFW with 12 paying centers on board, thank you. And the patient really love the solution. And we onboard imaging centers from, of course, phone calls, emails, face-to-face meetings. We build a comprehensive database of all outpatient imaging centers, about 314 of them. We onboard patients with SU, MO, physicians, make them know about our solution, and payers, self-funded employers, because we help both employees and employers save money. We also have partnerships with Southwest Airlines. We recently won their competition prize to fly to cities where we want to expand. We're a full stack team from healthcare and digital technology. I myself came from marketplace digital technology, and most of us built successful ventures before. Our plan is to build traction in DFW in the coming few months and expand to Houston in December and a few other cities nearby and to other cities In due time, we can also expand to other verticals. Our mission is to help improve healthcare efficiency and quality by introducing transparency. So if you like what we're doing, come find me afterwards. Thank you.
Beat her to the punch. I want to applaud the sheer genius of this plan, Sonny, because I was just on Obamacare last night for a family member, and I saw that the premiums were well over $1,000 a month and going up substantially next year, and the deductibles are just off the charts, like incredible, like $15,000 deductible, which tells me that anything proactive you do to be proactive on your health, you'll pay 100% out of pocket for. And anything reactive like cancer, where you pay $1 million for a cancer drug to extend your life by a week or two, will be covered. So with that in mind, how do you go to market with this? Is this an enterprise sale? Because it doesn't seem like the MRI center would be your fan, because you're going to reduce their price over time.
Thank you, David, for that question. Very good question. So we really, I see we're like on two legs with our approach to market. On one side is B2C. We wanted to present this to the consumers, the patients. We're fighting a fight patients cannot win on their own. Ideally, that would be great, but it takes time, as you know, take a lot of money. So the other avenue is B2B, that we approach self-funded employers, like Southwest Airlines. We're in discussion with them, 52,000 employees. Our solution helps those self-funded employers to save money and help employees save money. So through that, both models, we can grow faster rather than just charging the imaging centers. I didn't present that earlier because we're still in discussions right now, but that's definitely the direction we have to go.
I think I'm asking the same question, but I'm going to ask it a little bit differently, so hopefully I get a slightly different answer. I'm seeing your business like a hotels.com for medical imaging centers. So from that standpoint, a hotel would want to get on to hotels.com so that they can advertise their location and show the differences between that location versus another. Is the medical imaging location, do they have that same functionality, and why they're better than another? Is that now going to be a new competitive advantage other than price and price exclusively?
Thank you for that question. Most of the shoppers so far, based on our analysis, are for price shopping, about 75% so far. However, you always have that 10, 15% shopping for quality, either because they have a good plan or they have something, they have to find that wonderful 3D machine to do it. So our platform accommodates both. On one side, imaging centers can offer dynamic pricing. If they are very booked up, they can up their price. If they are very empty, they can lower their price. The whole goal is to help them optimize their profit margin by utilizing their expensive facility. So on the other side, on the quality side, so the imaging centers of higher quality, like THR, Baylor, they can list their accreditation equipment, the brands of the equipment, age of the equipment, their radiologists. So they can come to play as well if they want to. Yes, Sunil.
So I don't have a question, I just have a comment in support of Sunny for David. And of course, there's a conflict of interest. She's on my team at Health Wildcatters. But as deductibles are higher and higher in this market, if Sunny's product can get the cash price of the entire imaging study below the deductible, it becomes very, very, very attractive for somebody. Because one, the center doesn't have to go through the rigmarole of getting the payment, because that's an offensive process. And then the patient sees it direct, oh, my deductible is $800, and Sunny offers it to me for $500. It's a no-brainer. So So I really support what you just said.
Thank you, Sunit. Good question. So right now we have 12 centers. About 1/3 of them are doing it. They're still learning how to do it. We anticipate more as we go. Thank you.
That was good.